it. I think the first question was regarding the Mbagathi ward. The Mbagathi ward is when we... You can't hear me? Okay. The Mbagathi ward that the government has now taken hold of is indeed a building that was intended for other purposes, and as a national government we took it over because it serves our purpose of setting up an isolation facility there. So there is work to be done in terms of creating those spaces, creating the spaces for the divisions so that we can have the 120, and the capacity is 120 beds. That work has been planned for and is actually in the works. We are going to start to do that in the shortest period of time. We should have that facility up and running and ready to receive any cases that turn out to be positive for this. So it's work in progress. We are speeding it up. It will be there.
Any duration date?
We are on a fast-track mode. I think we have set ourselves that within the next, certainly within the next 1 month or so, we should have that facility operational. In the meantime, we have 11-bed capacity at Kenyatta National Hospital. And I think that is enough for us right now to deal with any situation unless we get an increase in numbers. But we think we can meet that target and have that facility ready. With regard to self-quarantine and what it means to self-quarantine, self-quarantine means that the individual must remain indoors and away from other people. And I think all of these passengers who are coming from China, and especially those who are the workers, because most of them are the workers working with the companies here, they have very strict instructions on how to do it. And most of them are doing this with fidelity. We know this because the embassy, we know this because we work closely with the Chinese embassy, who also helps us monitor. And again, to answer that question of who monitors, this is the work of now our teams, our response teams, both here at the national level and also linked to our county health systems, where we have cases in the counties. There is a linkage system where immediately, if there is information coming from the counties, it is linked to the response team here, who are then able to go and assist the county team on how to deal with it, or go down there and deal with it. Okay. So those systems are in place. About mingling with the crowd, I know that there is a lot said. I cannot say what is true and what is not true, but the measures that we put in there, we make it quite clear that for the system of self-quarantine to work, this is what must be done and must be observed. 14 days of quarantine.
So during these 14 days, what do they do? What is expected?
Self-quarantine means you remain indoor and you monitor yourself. If you have any symptoms, they have information on who to contact or call. And then they will receive that medical care. But the team also have their contacts, and they call them periodically to find out how they're doing.
With the case in Kitui, I was there, and then these Chinese they came all the way from JKI in a car, all the way to Kitui. In terms of contact tracing, what are you guys doing? Because as much as these people will self-quarantine, then what becomes of these taxi drivers? Is there a procedure for contact tracing?
Yes, there is a procedure. There is a procedure where this information is supposed to be recorded, both by the individual themselves and the team who will be sending them in a taxi or wherever. Sorry, I'm very sorry. I know this is where the cameras are. Okay. Yeah. So there are procedures that will be able to collect all the necessary information. In fact, not only from the point of travel within the country, but even within the flight. in terms of where they are seated, who their closest fellow passengers were. There are explicit procedures that record that information so that you can be able to monitor and track those individuals in the event that an individual turns out to be positive. That is the way we track, and we hope that we should work. I am coming. That was number 2. Your question, together with the question from the standard gentleman, raised the issue of why don't we, basically what you said is why don't we just stop the Chinese from coming in. And I think that is a discriminatory approach given now how the virus is spreading in many different countries. I started off by telling you the changing pattern of this virus. It doesn't mean because somebody is coming from China that they have. I don't think anybody would want to be labeled that because you come from somewhere, you have this virus and we need to bar you. I know some countries in the early phases when they evacuated their personnel and they had seen certain cases in their country, they did exactly what they did is they closed their borders and did not allow anybody coming, and not only Chinese, they said anybody who has come from China, a history of travel in China, would not be allowed in. I think the USA is one of those countries, except their nationals, whom they then put on quarantine.
What would you tell the parents of the children in Wuhan and the government said clearly they're better off in China than coming back to Kenya? Yeah. Yet they're Kenyans, but the government is allowing Chinese nationals.
Let me tell you something which I think sometimes escapes us. What is happening in Wuhan and Hubei province, Wuhan city and Hubei province, is that there is a lockdown. Lockdown meaning that nobody is allowed in or out. And that lockdown has been in place in order to bring down the transmission of the virus, because that is the epicenter. And we're beginning to see that there's some level of improvement in that area. So let's not talk about bringing, because it's a lockdown and people cannot travel freely. But these other Chinese nationals and even Kenyan nationals and others who are coming in, they're coming from other parts of Kenya where there is of China where there is no lockdown.
But other countries like Italy has moved the nationals from Wuhan.
Yes, several countries have done that. Yes, several countries have done that. We are now moving into the area of the students and evacuation, which I would not want to address because I think Ministry of Foreign Affairs should be able to address that. That's the issue. But with respect to travelers who are coming in from China, even if you stop flights coming in from China, flights come in and connect at different places. We have Ethiopian Airlines, we have Emirates, we have Qatar, which are active in that region in general, and they bring in passengers through transit. So it's not a solution to solve the problem now. A point might reach where that may be necessary. Yeah? But I think we should be careful not to label people in a certain way. I think it would be dangerous to do that. Yet we must always be careful that we are protecting our people as well. I think that is not lost upon us. We want to protect our people at all cost. Okay?
Yeah, my name is Joseph. I'm just wondering if at all the government has a mechanism to monitor these people who are under self-quarantine. Have we mapped out? Do we know where these 239 are?
Yes, they are known. Their contacts are known. Where they are staying is known, both by us as well as the embassy, Chinese embassy. We have their phone numbers and contacts.
And immigration.
As well as immigration. The Department of Immigration also collects the information. So we have this information and we know where they are and we monitor them, both as a ministry and the county level as well, and the embassy themselves. Call these people very regularly to find out what their condition is.
What will happen to some?
By the way, this quarantine, although we did it, this was a mass quarantine because of the flight, now the direct flight that came from China. But we had put this self-quarantine measure even earlier because Chinese nationals were still arriving on other flights. And the embassy worked with us in terms of imposing this self-quarantine. And it has worked fairly well up to now.
So talking of strict measures, what will happen to those who might? Because there are concerns, including by MPs, that there are some Chinese who are freely mingling with Kenyans. Yet there's something to be.
No, but you see, we can't say, because if this Chinese has has no history of travel in the last 14 days, there's no reason to say that that person is a risk.
From the flight.
Yeah, but this one of the flight, that is information you are telling us. We don't know, but if it is happening, it is something that perhaps needs to be corrected and set right. But we have taken those measures to at least make sure that they're there. In fact, the Chinese ambassador himself said that he will, if there are any defaults, be able to follow up. Because most of the Chinese are living in these work camps where the companies are, the construction companies, the water companies.
Let's take 2 more questions.
Captain Kaku for Citizen.
Yes.
Probably just simple. These people are doing self-quarantine from their houses, from their homes, where they have fellow family members. At the end of monitoring, they're being monitored, the rest of the family members. Secondly, is this our own invention or is also being practiced in another country? And thirdly, is it true that a Kenyan is tested positive in Vienna?
Okay. Okay.
From the same media, you are the same.
Yes, we're CNN. Good informative. The question about the case of monitoring, number one, were all the passengers on that flight Chinese nationals? We understand there were Kenyans there as well. How exactly do we monitor them? Because you don't understand, there's measures in place. So far you've told us that it's the Chinese embassy helping you monitor the Chinese nationals. What about Kenyans and any other nationals? On the airplane coming over, who does the monitoring there? And also, as you very well know, Kenya has been identified as a high-risk country by very significant international institutions and publications. As the highest risk country in East Africa, will you continue these flights from an area that's not the highest infection rate in China, but the second highest? Will you allow these flights to come in?
One last question.
Well, mine is
we have checked.
Mine is, well, we are
we
making these people self-quarantine. And the basic aspect of any Kenyan who is on mobility is on basic assets that they need. How is the government doing and what is the government doing in the provision of other amenities that the people need for them to remain indoors for the next 14 days?
Okay. Let me start with somebody asked about self-quarantine cargo. Cargo, is it? About self-quarantine and how we monitor? How we monitor this?
Monitoring.
Yes. Monitor is, as I said earlier, we have rapid response teams here. We have our emergency operations center. We have, if it is within the city of Nairobi, this is the team that monitors. They make calls. They may even visit the subjects. So that system of monitoring is there. It extends into county level for those who are outside Nairobi, and within the counties, that monitoring level extends now to the county health authorities there, who under the guidance of the emergency response teams here are able to monitor. Okay?
How many cases?
Now, your question was regarding family and whether there are standard guidelines. There are standard guidelines on self-quarantine issued by WHO. If a person has traveled and is going back to his household where there is family, self-quarantine means he must isolate himself also from the family within the house. He must remain in a particular room and not allow that contact, because that transmission can happen. In that case, then, that is the person who is under self-quarantine, as long as he observes those conditions of not freely mixing with members of his family within his household. Because of the way the virus is transmitted through close contact, through air droplets and so on, he will be the quarantined person. However, if he does mix with his members of his family, then the entire family is under quarantine. Okay? Now, many of the Chinese who are coming here as workers live alone. So it is not an issue. They self-quarantine in their facilities on their own. Okay? The question from CNN was, how do you monitor again, isn't it? I think I have answered that in terms of the monitoring process.
We don't understand how an individual, it doesn't have to be Chinese, any nationality, Kenyan, businessman coming back from China who has goods to sell, how is this person monitored? How do you...
In the same way, the person is instructed that he is given strict instructions according to these guidelines on what to do. Go home, do not leave your home. If you have a family, isolate yourself, and for 14 days.
So it's an honor system, basically, you're relying on.
It's a
honor system. You would
well,
get the person to do this themselves.
There is a level of that, I would say, yes, because people have to be careful about their health. If it were me and I had a family, and I was told that that was the option, of course I would isolate myself and not pass the risk on to members of my family. But there is the monitoring system where, you know, the individual is asked